What is pneumonia? Pneumonia is a serious infection of the lungs in which the tiny air sacs called alveoli become inflamed and fill with fluid, pus, or mucus. Under normal conditions, these air sacs remain open and elastic so they can efficiently exchange gases. Specifically, oxygen enters the blood and carbon dioxide leaves the body. However, when pneumonia develops, these air sacs become swollen and clogged with infected fluid. Because of this, oxygen is unable to pass efficiently into the bloodstream, which results in difficulty breathing, fatigue, weakness, and low oxygen levels in the body. Pneumonia is not a single disease, but rather a general term for various types of lung infection that may be caused by bacteria, viruses, fungi, or aspiration of foreign material. The severity can range from mild illness that improves with rest and medication to a life-threatening condition requiring hospitalization and intensive care. The danger level depends on the cause of infection, the patient's age, immune strength, and underlying health conditions. People who are very young, elderly, or medically vulnerable are at much higher risk of developing complications. This includes infants, children under 5, adults over 65, people with diabetes, asthma, COPD, heart disease, kidney disease, cancer, HIV, or anyone with a weakened immune system. In such individuals, pneumonia may progress rapidly and must be treated promptly and carefully. Symptoms of pneumonia. General symptoms in most adults. The symptoms of pneumonia can vary widely, but most patients experience some combination of cough, fever, breathing difficulty, weakness, and chest discomfort. The cough may be dry or it may produce thick phlegm that can appear yellow, green, brown, or occasionally blood-streaked. The presence of phlegm indicates that the airways are producing mucus in response to infection. Most people develop a fever, which may come with chills, sweating, and shaking. Because the lungs are not oxygenating the body effectively, many patients feel short of breath, particularly when walking, climbing stairs, or lying flat. They may breathe rapidly or shallowly, and some people experience wheezing or noisy breathing. Another hallmark symptom is chest pain, especially sharp pain that becomes worse when coughing, sneezing, or taking deep breaths. This occurs because the lining around the lungs, the pleura, becomes irritated and inflamed. In addition to respiratory symptoms, people commonly feel extreme tiredness, weakness, sleepiness, dizziness, loss of appetite, nausea, or body aches. These symptoms appear because the body is using large amounts of energy to fight the infection. And symptoms in children. In children, pneumonia can look different from adults. Children may breathe very rapidly, make grunting or wheezing sounds, or show flaring of the nostrils while breathing. Babies may refuse to feed, vomit frequently, or appear unusually sleepy, irritable, or weak. Some children may not cough much but may still have high fever and breathing difficulty. Parents should seek medical attention if a child appears to be struggling to breathe or stops responding normally. Symptoms in elderly people. In elderly adults, pneumonia may present in a less obvious and more dangerous way. Instead of fever, they may develop low body temperature, fatigue, confusion, memory changes, or disorientation. These signs indicate that the brain is not receiving enough oxygen. Elderly individuals may also collapse or feel suddenly weak. If the lips, fingertips, or face appear bluish or grayish, this signals dangerously low oxygen levels and requires emergency treatment. How pneumonia happens and what causes it. Bacterial pneumonia. The most common cause of pneumonia in adults is bacterial infection, particularly infection with Streptococcus pneumoniae. This type of pneumonia often develops after a person has already had a cold, flu, or throat infection because the respiratory system becomes irritated and weakened, making it easier for bacteria to invade the lungs. Bacterial pneumonia tends to develop suddenly, producing high fever, chills, sweating, chest pain, and thick phlegm. Viral pneumonia. Many cases of pneumonia are caused by viruses, including influenza, flu, RSV, and COVID-19. Viral pneumonia is especially common in children and older adults. It may begin like a normal viral infection with fever, sore throat, runny nose, and body aches, but over time progresses into shortness of breath and worsening cough. In some individuals, viral pneumonia can weaken the lungs enough that bacterial infection develops on top of it, known as secondary bacterial pneumonia. Fungal pneumonia. Fungal pneumonia occurs less frequently and typically affects people with weakened immune systems, chronic illnesses, or long-term use of steroids or chemotherapy. It may develop gradually and produce chronic cough, fever, and weight loss. This form of pneumonia requires specialized antifungal treatment. Aspiration pneumonia. Aspiration pneumonia develops when food, liquid, saliva, or vomit accidentally enters the lungs instead of the stomach. This can happen in people who are unconscious, intoxicated, elderly, bedridden, or who have swallowing or neurological problems. The foreign material introduces bacteria into the lungs and causes inflammation. How pneumonia affects the human body. When germs enter the lungs, the body attempts to defend itself by activating the immune system. Large numbers of white blood cells travel to the infected areas to fight the invading organisms. While this immune reaction is necessary, it also triggers inflammation. The air sacs become swollen and filled with fluid, mucus, and cellular debris, which narrows the space available for air to move through. Because of this inflammation, oxygen absorption decreases sharply. As oxygen levels fall, the body becomes weak and organs begin to function less efficiently. The heart must pump harder in an attempt to deliver adequate oxygen to tissues, which may cause rapid pulse, fatigue, dizziness, or fainting. The muscles receive less oxygen, leading to weakness and exhaustion. If pneumonia becomes severe, the infection may enter the bloodstream, leading to sepsis, a life-threatening condition that can cause shock, organ failure, or death. Fluid may accumulate around the lungs, known as pleural effusion, or pockets of pus can form, known as lung abscesses. In extreme cases, the lungs may fail completely, and the person may require mechanical ventilation in an intensive care unit. How pneumonia is diagnosed. Doctors diagnose pneumonia by carefully evaluating symptoms, medical history, and risk factors such as age, smoking status, existing illnesses, or immune problems. During the physical examination, the doctor listens to the lungs with a stethoscope. Pneumonia often produces crackling, rattling, or bubbling sounds or areas where breath sounds are reduced or absent. To confirm the diagnosis, a chest X-ray is usually performed. The X-ray shows areas of the lung that appear cloudy or consolidated, indicating infection. Blood tests may be ordered to check white blood cell levels and inflammatory responses, and oxygen levels may be measured using a pulse oximeter, which clips onto a finger. In some cases, doctors may collect a sputum, phlegm sample, or perform additional scans or tests to determine the exact organism responsible for the infection. How pneumonia is treated or cured. Medication and medical treatment. The treatment of pneumonia depends entirely on its cause. Bacterial pneumonia is treated with antibiotics, and it is extremely important to complete the entire prescribed course, even if symptoms begin improving early, in order to fully eliminate the infection and prevent resistance. Viral pneumonia does not respond to antibiotics, so doctors prescribe rest, fluids, fever reducers, breathing support, and sometimes antiviral medicines. Fungal pneumonia requires antifungal medication, usually over a longer treatment period. Supportive and home care. Supportive care plays a crucial role in recovery. Patients are advised to drink plenty of water to thin mucus, rest adequately, eat nourishing foods, and avoid smoking and exposure to pollution or dust. Breathing exercises and sleeping in an upright or semi-reclining position may help reduce discomfort and improve airflow. Cough medicines are sometimes prescribed, but many doctors recommend allowing the cough to clear mucus naturally unless it becomes severe. Hospital treatment. Patients who have severe pneumonia, dangerously low oxygen levels, weak immune systems, or multiple health conditions may be admitted to the hospital. In the hospital, treatment may include intravenous antibiotics, oxygen therapy, intravenous fluids and breathing support, and in very severe cases, intensive care monitoring or ventilator support. Recovery time depends on the severity of infection and overall health. Some patients recover noticeably within 1 to 2 weeks, while others may need several weeks or even months before lung function fully returns to normal. Fatigue may continue for some time even after the infection is gone. How pneumonia can be prevented. Prevention plays a major role in reducing pneumonia risk. Vaccination is one of the most important protective measures. The pneumococcal vaccine protects against a major bacterial cause of pneumonia and is recommended for young children, older adults, and people with chronic illnesses. The influenza vaccine and COVID-19 vaccine help prevent viral infections that commonly lead to pneumonia. Practicing good hygiene is equally important. Washing hands regularly, avoiding touching the face with unwashed hands, Covering the mouth when coughing or sneezing, and avoiding close contact with sick individuals reduce exposure to infection. Quitting smoking is extremely important because smoking damages the natural cleansing system of the lungs and significantly increases pneumonia risk. Maintaining a healthy lifestyle, including balanced nutrition, adequate hydration, regular exercise, and sufficient sleep, helps strengthen the immune system, making the body more capable of fighting infections. People at risk of aspiration should eat slowly, sit upright while eating, avoid lying down immediately afterward, and seek treatment for swallowing or reflux problems. When to seek urgent medical help. Immediate medical care is required if a person develops severe shortness of breath, chest pain, confusion, bluish lips or fingertips, persistent high fever, fainting, or worsening symptoms despite treatment. These warning signs indicate serious oxygen deprivation or complications that may become life-threatening without urgent care. Thank you for watching. See you in the next video.